boards, so many things on my mind. But what I remember where I began was when we had a young Emilio came into my office as in my last semester, and he gave a presentation on resumes and how to prepare for applying to be a nurse. He gave us a lot of pointers, a lot of tips, a lot of very a wealth of information that I used as a guide to make my resume. After I did that, I went ahead and I made an appointment with the career development office so they can help me make that resume superb. After I did that, I went ahead and I took the NCLEX, which I studied over a month. I studied about a month, a little over a month for. And after I passed the NCLEX, I went ahead and I started looking at the job market, seeing what's out there. And I made a list of possible interests. What kind of nurse do I want to be? Because there's so many different avenues you can take in nursing. And I decided that I wanted to be, stick with the little people. I wanted to work as a pediatric nurse or possibly the NICU, something like that, in that population. So after I narrowed that down, I went ahead and I made a list of different facilities that I'd like to work for. And that's how I came up with my game plan. And I made sure that all my professional documents were updated. I made sure all my certifications were updated. I know when you start NOVA, they make you take a BLS certification. So around this time is going to be the time that you're going to have to renew that. So I just made sure I had all that ready, available.
So some good tips. What about the NCLEX? I feel like one of the scarier parts of graduate is not just the job search, but passing your NCLEX exam. Is there any tips that you can provide to new graduate nurses, Rochelle, about taking the NCLEX or just mindset and things you should be doing for best practices for that?
Yes. The NCLEX is probably one of the scariest things that I had to face, just because it's like that first big test that you're ever going to have to face as a nurse. One thing that I kept telling myself is, obviously you don't want to fail, but I kept telling myself, you know, if I don't pass, I can take it again, and I can take it again, and I can take it again. And that's the bottom line. That's what I told myself to calm my nerves. A little bit of anxiety is good, but you don't want to be so overly anxious where you can't focus. So before I even hit the NCLEX, I made a timeline for myself on the different topics that I wanted to hit within the book that I was studying, which was the Kaplan book. And I made sure that I studied a certain amount of topics for the day within a month. And each topic that I studied, I made sure I did all the questions that were provided for that topic within the Kaplan program. And when it comes to different programs, as far as NCLEX prep, I highly recommend the Kaplan because that is the best of the best that's out there.
That's great. And, you know, some of the things that Rochelle started off on where to begin is starting early. I think whether you're planning to take the NCLEX or obviously job and residency search, you got to take some time to prepare yourself. You know, one of the first things she mentioned is coming to the career development office, meeting a career advisor. And that's not by chance, because by meeting with a career advisor, it helps you create a game plan, strategize for your job search, perfect your professional documents, your resume, your cover letter, understand what resources are out there, what hospitals, and really having someone in your corner that can give you true guidance in terms of what you should be doing in the job search. But starting early on is important. You should also take some time to self-assess what's important to you in your job. What are the settings you want? You know, Rochelle was able to go into pediatric nursing, but it took some time to her think about what is the best setting for her. What are the skills she wants to use? Where does she feel that her skills are best used in? So it's really prepare yourself. Instead of just waiting till graduation day to start, you should be starting already beforehand and creating a game plan and getting everything together, something that the career development office and your mentors can assist with. Now, job hunting tips for new graduate nurses. Rochelle, before I dive a little bit into this topic, and I know we're going to be talking about residency things and a lot of different topics, but is there any tips you can give to new graduate nurses as they enter the job search?
You know, as I said in the previous slide, making a list and narrowing down what you really want to do as a nurse is key, because you want to make sure that you're happy doing what you're doing, especially because you're going to be doing it for a while, The other thing is not just a hit list of what kind of nursing you want to do, but the different facilities you want to apply to. Another thing is, while you're doing your resume, and they can help you in the career development office. I know in the last semester at Nova, they do something called preceptorship. And for example, in my preceptorship, I did hours at Miami Children's Hospital. So I made sure that I had those experiences that I had at Miami Children's Hospital listed on the resume, to show that I have experience in the population that I want to be working for. Another thing that I did is, I know the slide says join professional organizations. I also joined the ANA and also the FNA. Another thing to note is that these look great on your resume, because it shows that you're active in your field. But another thing is, they also give discounts for students. So if you do apply now, I know they give you like half off, or and it's worth it, because there's also a lot of resources and different opportunities that these organizations provide for nursing across the board, whether you're experienced or not.
Really good tips. And going back, reiterating, starting early, Rochelle mentioned a great strategy, creating a hit list and hiring strategy. So thinking of, hey, I want to live in South Florida, or I have a specific area I'm thinking about. What are the hospitals in that area? What's the opportunities they have available? What are they looking for? Do you have anyone in your network that you're connected with? Your preceptor, your instructors, onwards, finding anyone that could you leverage. We've talked about perfecting your resume, but you can't have just one resume for everything. You need to use the language of that organization. You need to target your resume for that specific setting. A resume for medical, surgical, or adult patients is going to look very different than pediatrics. And so you need to gear it towards those specific areas. Rochelle talked about joining a professional organization. I think that's huge. A lot of these professional organizations have their own job boards, obviously networking opportunities, great tips, and they host a lot of free webinars or events that can get you out there. So this could be another really advantage for yourself. Organizing your job search. I think developing an Excel spreadsheet of what you apply to can keep you organized. Because let's say you start applying to jobs. Every day you apply to 2 to 3 jobs. Guess what? After 2 weeks, that's a lot of jobs that you're tracking. And these hiring managers are going to be contacting you. You want to be able to be sure that you know what you're being interviewed for and what they're asking you questions on. I think it's important that when you apply to jobs, save the job description. Because guess what? When you actually get called, that job description is probably going to be taken down already. So it helps you get familiarized on what you were applying for, what were the key words they're using, values they're looking for, all of those pieces. Search and find the right opportunities. Don't just take any opportunity that's available because you want a job. I think it's important to really find out what your passion area is. It's going to allow you to not get burnt out, because whether you're going into a residency or job, you want to make sure that the area you're going into, you're actually passionate about, and you're going to be driven every day within the setting. Prepping for the interview, we're going to have a whole slide on getting ready for the interviews, but this is a really important time to get started on that. I don't know if you got to mention this, but was that something else that you did early on? Were you kind of preparing for the interview, or did you take steps to hone in on your interview skills?
Okay, so the interview had me super nervous, because although I'm a people person, sometimes you don't have the right words and to express yourself, and you want to make sure that you're putting your best foot out there forward. When you're meeting with these people, you want to make a good impression, So the first thing that I did, I was like, okay, I need to get on Google. I need to start Googling interview questions and tips, and specifically for nursing. So what I did was, I found on YouTube, I found a few videos of people, different nurses, that recorded about their experience. They talked about the questions they would ask and how to answer them. Obviously, you would tailor your answers to your own experience, or your own experiences as a nurse, or as a employee. But there's two people that I wanted to mention that really helped me with this. More recently, Nurse Blake is very famous. And I know he has a few videos on interviewing tips and also questions and answers. But the one that I really honed in on was Caroline Porter Thomas. She has a few videos. She's wonderful. She is very easy to understand, and she gives a lot of insight on the interview process. She also has a book about it. So I would definitely look into Caroline Porter Thomas.
Yeah, so another great knowledge nugget there. And finally, the last thing outside of preparing for the interview is pay attention to application keywords. You know, like certain organizations, you'll notice in the job description use very specific wording. And so if you're using the word advocacy, try to mimic that on your resume. A lot of application portals for heavy applications will use a computerized system as the first round of defense. And so they're going to be searching your resume and your application for different keywords that they really want in their nurses. And so it's really important to read those job descriptions and try to take some of those keywords and implement them into your own professional documents. Career resources. So talking about the job search, we're going to talk about residency and all these things, but what can I use to find or look for opportunities? First, Handshake. So Handshake is the career platform used by NSU. It's used by a majority of colleges here in the country. And this is the #1 place to find jobs and opportunities being posted around the country. Free to use. It also has a lot of different resources, sample resume, hiring events. We've posted on their hiring events for Memorial Hospital, HCA system. It's great because we have connections with these hospitals, and it's a great way to find the resources you need all in one. Obviously, career development, which manages the Handshake platform, but our advisors can help you out. Myself, my role is I work with employers. So let's say you apply to a residency or a job in a certain hospital. I can actually send your resume directly to the hiring managers and HR people there to help put a referral on your behalf. Definitely looking at hospitals' HR pages. So this is where it goes to your hit list, understanding what hospitals in the area that you are applying for and looking at their HR pages. Sometimes hospitals get very busy and the only time or the only setting that they have it posted is directly on their HR pages. So you have to check that. LinkedIn is another great avenue. They have a lot of different jobs posted. It's also a great networking platform. Or if you meet someone at a conference through professional organizations, don't just hope that this person's going to remember you a year or two from now. Right after that interaction, you should be adding them to your LinkedIn profile, build that up. I think LinkedIn can be very valuable. Rochelle, do you have a LinkedIn? Is that you view as a valuable tool for you as a nurse?
Yes, LinkedIn is great. The first time I ever heard about LinkedIn was with Emilio at his presentation for career development. And as a nurse, it's wonderful because you can connect with fellow colleagues, and not just colleagues, you know, that you're going to school with, but also people that can, you know, branch out into and show you different opportunities that are available for nursing. It's great.
Yeah. We also, another resource for you is our nursing newsletter. So bi-weekly, we actually send a newsletter out that lists all the residency, jobs for new hired nurses, nurse practitioner jobs, recent trends, webinars, you name it. So that newsletter can be very valuable for you on the job search. But leveraging your network, preceptors, instructors, these are also resources to you, whether they know about opportunities or just giving you guidance as you go about the application process. And we've talked a lot about professional organizations and developing your network through that. But these are just some of the career resources available to you. There's other sites that really list all the residencies in Florida and other opportunities. These are just some of the things available to you. And I think this kind of leads us perfectly into our next slide, which is about nursing residency. So I know you alluded to the fact that you did a residency. Can you talk about the residency process, overview of your experiences, why it's of value for new graduate nurses, and really how it sets you up for a full-time job afterwards?
Okay, so in my opinion, I swear by the nursing residencies. They are wonderful for new graduate nurses. And I'm saying that because there aren't a lot of opportunities for new grad nurses otherwise. Most of these jobs are wanting nurses that have a minimum of 2 years experience, and it makes it very difficult for the new grad nurse to, obtain any type of experience without getting their foot in the door. The nursing residency is a great opportunity for you to get foot in the door. And not only that, it's a great transition from being the nursing student to working as a nurse on the floor. It's wonderful. I know a few hospitals that have the nurse residency program, one of them being Baptist, and I can tell you a lot about the Baptist program because I work for Baptist. But HCA hospitals also have a nurse residency program. Broward Health, Joe DiMaggio, all these hospitals have an RN nursing new grad residency program. Usually they are about 16 to 18 weeks long, and they usually open up for hiring twice a year. So I know there's one upcoming for Baptist. They're going to start their program in August of this year. And I actually spoke to the HR representative this morning, and she told me that the best way to go about it is to check their careers page on Baptist, specifically for Baptist, 2 months in advance so that you can go ahead and start putting your application out there. Once they go ahead and they choose you based on your application and your resume and all that, you'll get a phone call from somebody in HR, and they'll ask you a few questions over the phone, like a mini interview. And after they do that and they decide that they want to choose you to go to the next step, they'll call you in for an in-house interview with the HR representative. If you pass that step, during that time, they'll ask you, where would you like to work? Would you like to work with adults? Would you like to work with surgical patients? Would you like to work in the ICU or pediatrics or in the NICU with the babies or labor and delivery? Once they do that, they go ahead and they set up an interview with that department. So for me specifically, it was pediatrics. And at that point, I had a 13-panel person interview with the pediatric department. And that's the last of the interviews. And then once you do that, they'll go ahead and start the residency program once they do accept you. So for the first few weeks, it'll just be a general nursing education and evidence-based practice tools and different things like that. And then once you reach a certain amount of time, you'll continue your education and training with that specific department, along with mentorship with a fellow nurse that you'll be paired up with experience, to continue the rest of your journey during the residency and eventually be practicing on your own.
Yeah, I completely agree with Rasha. I think a residency is a perfect fit for new graduate nurses. I think especially right now with what we're dealing with, hospitals for full-time jobs are really looking for those with experience. Just because of COVID-19, it's sometimes hard to do additional training where the training and residency is already built into the program. So it really helps you get your feet wet before jumping in. And it does set you up for a full-time job afterwards. Just like the job search, this is something career development can assist you with. But it's a really great opportunity. There's no lack of programs. Rochelle mentioned a lot of different ones. I know Memorial and a lot of other hospitals or health systems for that matter have these opportunities available to you. But it really does set you up for a full-time job and really eases the transition from a student nurse to a full-time nurse in the field.
Just to cut in really quick, I see someone here is telling me that it's really hard to get into the Baptist residency program. I believe you. I've been there. What I'm going to tell you is right now, especially because of what's going on in the world with coronavirus, there's a huge nursing shortage coming, a huge one. So what I'm going to advise is that you start 2 months prior to August, and every day on a daily basis, you need to check that, because the earlier you apply, it's kind of like a first come, first serve. The earlier you apply, the more of a chance you have of getting that phone call. And before you even get to that application process, I would set up an appointment or some type of meeting or an email out to your resources out at NOVA at the Career Development Office to help make sure that you have that resume ready and prepared. Maybe you need to tweak something. It is difficult, and I completely understand where you are, but have faith, and I have a feeling that it's going to be a lot easier this time around because there's a huge nursing shortage. Trust me.
Yeah, and I think something else is be proactive. Like Rochelle mentioned, she was curious about where because obviously she applied to residency like 5 or 6 years ago. Now, she wanted to know information, and she went to the page, found the number, and gave it a call. I would recommend that type of proactive approach. I know in some industries it's just easy to click and apply and hope you hear back. With what the times that we're dealing with and the competitive of these applications, put your best foot forward, contact HR, find out more information. Especially with COVID-19, there might be some delays on the application review process or other things going on, but be proactive on your side and get information and apply to multiple programs to set yourself up for success. Maybe not just here in South Florida, but looking at other parts of Florida, from Orlando, Tampa, Fort Myers onwards, there's a lot of opportunities, but being proactive, because right now we are in unknown times, so some things aren't clear, and that's where you being proactive, you're going to be hearing it from the source. You're also going to be able to build a connection so you can get some of your questions answered. So if they're delaying the hiring for a residency or a program, you're going to be hearing it firsthand, and at least you've built a relationship with the individual that's managing the process itself. So some other tips going into the residency search. I've already talked about making an Excel list, know what's out there, conduct outreach to your network to know if they can leverage or you can put referrals, or they can put referrals on your behalf. Saving job descriptions, as we talked about, saving searches or setting job alerts with the systems themselves. And we talked about calling and contacting these residency programs, tailoring your documents to the specific programs or jobs available. And I think something that we haven't talked about is consider your values and non-negotiables. In every job, in every career, there's trade-offs. Make sure that the trade-offs you have to make early in your career are something you're willing to do, something that's still going to provide you the value and kind of passion that first led you into this field of nursing. So you had an RN resume. So I have a lot of tips for this, but Rochelle, why don't you tell us a little bit about when you first created your resume as a new grad RN? Is there any tips that you were given or that you implemented that you felt put your document in a position of success?
Yes. When I went ahead and started working on that new grad RN resume, I remember a few worksheets that I was provided with by Nova just to help the formatting and the whole style of the whole thing. But I also made sure, as I said in the previous slides, I made sure that I really highlighted the clinical experience that I had during my preceptorship, because I knew where I wanted to go in my career. I knew I wanted to work with pediatric patients. So I made sure that I showed that I had that experience there. Another thing that I wanted to mention is, I know earlier you mentioned about keywords. You want to make sure that you, in your experience as an RN, that you put out there words, like you said, advocacy, because as a nurse, you hold a lot of hold a lot of roles. You have a lot of hats. So you're a patient advocate. You're also an educator. You're not just doing tasking skills. You're also a mentor in between families sometimes. You hold a lot of different roles. So you want to make sure that you put that in there. Another thing that's great that I see here is a community involvement, because I know a lot of us have, work experience, but maybe not necessarily in the clinical area. I mean, before I was a nurse, I worked as a makeup artist. So, I put that in there in my resume, but yes, it wasn't clinical, but it showed that I had a lot of people skills and I was able to interact with different types of personalities. So, and the community involvement, you want to show that you're involved, because these facilities want nurses that are involved. They want people that are hands-on, that go the extra mile for their community, because that's what a nurse does. And definitely include your licensure and any extra certifications that you have can really add an extra boost to that resume.
Yeah, these are some really good tips, things that myself have said in the past, and I think it's really key to your success on your document. Those keywords, honestly, I've heard from hiring managers in nursing that if they don't see the word advocated once, it takes away from it, because not only is a word they're looking for, but it talks about your philosophy and how your values align with the field. Because, and we're going to talk about interviews in the next few slides, but one of the things you're going to be asked is how have you advocated for a patient before, and how do you define patient care? And so these are really key elements to your document. Some other tips I would recommend is keeping it to one page. And I know some of you are like, well, Rochelle talked about community work, clinical. How do I keep that to one page? This is where the career development team can come in, because we have a lot of different strategies, whether keeping your margins to a 0.5 all around, play around with your font size to keep it to minimal while still keeping that readability. Speaking of readability, format and style go a long way. Hiring managers and HR teams, they only read a resume for about 15 seconds. So you need to be strategic with your bolding, your italicizing, your underlining. I also recommend putting targeted headings. So Rochelle talked about your clinical experiences. If you're applying to a pediatric setting, you could list additional clinical experiences, but one of your first sections after education and certifications should be a section called pediatric clinical experiences. Zero it in. Expand on those bullet points more than other bullet points, because it's in the apples to apples setting of what you're going into. We've talked a lot about keywords, strategic bullet points, making sure that you put yourself in the hiring manager's shoes. Like, you should ask yourself, what makes up a successful nurse? The skills, the approaches, the knowledge, the bedside manner. And then on the other side, how have I used those skills in other settings, whether it's in clinical settings, work settings, community work, you name it. Try to incorporate those skills within the bullet points themselves. Don't just have everything in one bullet point that says responsibilities included and then a laundry listing of things. You want to be strategic on how you're delivering this information. Rochelle made a good point about adding work and community involvement, and why those transferable skills still are very valuable and something that nurses or hiring managers are looking for, especially in new RNs. And then certifications and licensures. Putting your BLS, ACLS if you have it, your PALS. If you're, obviously you're going to be taking the NCLEX and you're going to get your N number, your RN number. Even if you haven't gotten your results for your NCLEX number, you could list it there, and you could put the anticipated date that you expect to get your results in. So you could already include that on your resume. So some effective interview skills. So this is definitely deeper into the application portion where you're being called in, and I'm going to be talking a lot about different things, but Rochelle, curious to know what are some tips you have for some effective interview skills?
Okay, so my interview at Baptist was quite a show, I like to say, because I had the whole panel laughing by the end of the interview. But that's my personality. I'm a very goofy person. I'm very outgoing. So I think one important thing is to be yourself, because you want to show a certain type of transparency. When you're applying for these jobs, they want to know that you're a transparent person. Another thing is when they're asking these questions and you're giving these answers, you kind of want to paint a picture for them, kind of like storytelling. Because it gives them a good idea of how you would handle a situation, whether it be a great situation or even a difficult situation, how you would deal with a difficult patient or a difficult family member, or even some type of issue that you may have with a colleague. How would you deal with that? You also want to show passion and love for not just nursing in general, but for the type of nursing you're applying for. You want to make sure that you're well equipped, based and prepared for the knowledge in that area that you're applying for, because they might ask you clinical questions. So you want to make sure that you have the appropriate answers for those things. And if you don't know, because you don't know everything and you're a new nurse, if you don't know, it's okay to say, you know what, I don't know, but let me tell you what I would do. I would ask a supervisor, or I would ask another colleague, or I would ask anybody to get that answer. But at the same time, maintaining patient safety is the goal. You also want to make sure that you have some questions prepared because just like they're interviewing, you know, you also want to know about the facility that you're working for. So ask about the type of resources that they have for their patients. For example, for me, when I applied for the pediatric department, I asked what are the resources that they have for the children while they're there, especially when they're there for a long period of time, like oncology patients or more chronic patients. What do they have available for these children and their families too? And that's pretty much it.
Yep. These are amazing tips. Honestly, reiterating everything I would mention. I would also talk about know the different types of interviews. You might have an interview one-on-one with the hiring manager. You might have interviews with the, like, let's say you've passed that first and second round of interviews. They actually might make you meet with the nurses you'd be working with on that floor. And that's going to be a different type of interview where the hiring manager is figuring out, can you do the job? Are you a good culture fit? Where that interview with the other nurses might be more of, how are you going to work on a team with them? Do you match well and everything like that? But also keep in mind that, especially with COVID-19, you might have interviews that you're virtual. You might have to do a Skype or Zoom interview. So testing your technology, understanding to make eye contact with your camera, all the things that come into play in an in-person interview, but they come with new challenges when you're doing it virtually. What Rochelle mentioned of being yourself, that's so key to an interview. If I had to give two main tips, is be yourself and storytell. Anyone can walk into an interview and say what that person wants to hear. I'm a team player, I'm passionate, I go above and beyond for my patients, yada, yada, yada. You need to back those things up with direct examples or experiences that show that interviewer that you can do that, not just that you're saying it. So storytelling and giving examples is one of the key elements and biggest tools in your toolbox as you go into interviews. Showing passion, guys, you could be nervous. It's okay to show a little bit of nerves, but being excited, that's something that you could do even when you're nervous, because you want to show them that you want this. And the whole point of an interview is for them to get excited about your candidacy. How's that going to happen when you're not even excited to be there? So yes, you're nervous, and that's okay, but show excitement. Review the knowledge base. In addition to questions like behavioral or situational of, tell me about a conflict, tell me about yourself, your strengths and weaknesses, what have you, you are going to be tested on your knowledge base within that setting. So review certain procedures, order of operations, or approaches. You want to be sure that if you get asked, like, you're dealing with a myocardial infarction, what would you do first? You're ready to kind of approach that situation and deliver the answer in an appropriate manner. And unlike some other questions where there's multiple answers to it, sometimes those knowledge-based questions, it's a very specific answer that they're looking for. So reviewing that information can be very key for you. And know the qualities that they're looking for. Teamwork, obviously, but knowing the setting you're going into will help you know the order of some of those qualities. Obviously, in an emergency room, being able to adapt to situations, fast-paced environment, prioritizing care for certain situations. Working with kids, you're going to have therapeutic communication. All of these other skills come in, and there's almost sub-branches of these skills based on the setting that you're going into. And some common interview questions. And I wanted to list it so you guys can have an idea, but I'm going to tackle a few of these. You know, when you get asked your strengths and weaknesses or your qualities that make up a successful nurse, don't just say the strength or the quality, back it up. So if you say, hey, one of my strengths is I'm very good at communicating information. Great. Back it up with an example or an overview of where you've used that skill before. For strengths, I always recommend having at least 2 to 3 strengths. And for weakness, make sure you're providing a real weakness. You should never say, oh, I'm a perfectionist. That's not really a weakness. What they're really trying to figure out when you get asked the weakness question is, you're the type of person that can self-assess yourself and take steps to improve on something that right now is maybe a shortcoming. So, because in nursing, guess what? A lot of times, you're not going to be micromanaged. And the expectation is you have the integrity and proactive mindset to develop and improve upon your skill sets. So if you get asked a weakness, be honest. It might be public speaking. It might be leaving your comfort zone, or it might be a lot of different things. But then provide them direct steps on how you've worked on that weakness and improved upon it. Qualities that make up a successful nurse. Don't just say the quality, back it up on why it's so important within the nursing field. Why did you decide to become a nurse in the first place? Don't just say, I want to help others. Again, they want to know what makes you tick. Everyone that's going to go in there says they want to help others. Why is that important to you? Why is that part of your values? Where did that derive from? How did you confirm that that in this setting in nursing, that's how you wanted to impact the lives of others? But we've talked about the best nursing interviews, or the best interviews are all about storytelling and examples. So you can see all these questions. Tell me about your memorable experiences, your most difficult experiences. The best way to dive into this or address these questions is a direct example of where you've had it. That's why prior to interviews, you should really do some story banking, thinking about the questions you might be asked and what are the best stories to be able to deal with that. Now, if you get asked a difficult, experience you've had with a patient, it's okay to talk about that difficult experience, but just don't throw anyone under the bus. Don't talk negative about the company, that hospital, or anything like that. Focus on the experience itself. Why was it negative? What happened? And then talk about after that experience, what did you learn and how did you implement that learning experience in future opportunities? How would you deal with someone who's unsatisfied with their plan of care, their patient care? Again, talking about those therapeutic communication skills, that ability to diffuse a situation, your active listening skills is really important, where you can explain your process so that that committee or that interviewer really has a good handle on how you would deal with it in their setting. How do you work in a team? How do you, tell me about a time you worked under pressure and how did you resolve that? Again, guys, storytelling, examples, being able to go from theory to practice, like, the theory of when things are going wrong, what do you do? And then a direct time of when it happened. Tell about the time you worked in a fast-paced environment, how you prioritize your plan of care. Because these are all things that your examples, storytelling, being able to help them understand that you know what you're getting yourself into and you know how to work yourself out of these situations. But these are just some of the common questions that come up. In our office, we actually do mock interviews with you. And chances are the mock interview with us will be a lot more difficult because we want you to get that deer in the headlights look, get a little bit of that struggle. So it will be a much easier process in a true professional setting. Finally, we're getting into our last slides here, industry trends and advice for new grads. Sure, you want to maybe hit up points that you've said already, or just talk a little bit about some trends and advice you'd have for new grads?
Yes, I know that I spoke a little bit about the current situation with the coronavirus going on. Currently, because there's, at this current time right now, because of the coronavirus pandemic, what the job market is really looking for are those experienced nurses to work in the ICU because of the pandemic. But this isn't forever. So for me, the best thing that I can tell you is to go straight into that RN residency program. That is going to be your foot in the door. As I said before, especially because of what's going on now. It's going to be even harder for you to get a job as a new grad nurse if you don't go through that RN residency program. And they will need nurses because there is a shortage right now. There's people doing roles that they're not even supposed to be doing because we're so short-staffed. And that RN residency program does a great job at transitioning you from being that student nurse to a working nurse on the floor. Another thing is, plan to be open to new opportunities as a nurse, because you're not going to be staying doing the same thing forever. And you don't want to. You want to grow as a nurse. You want to show you want to show up for different opportunities. So be open to those new opportunities, because not only do they make you more well prepared as a nurse, but they also do a nice job at beefing up that resume so that you can, transition to other opportunities out there. set up future goals for yourself, like I did with the nurse practitioner program. That's a wonderful way to grow in the nursing industry. And that's pretty much it.
Some great tips. And finally, we've talked a lot about how career development is here for you. Even during COVID-19, we're taking appointments virtually via Zoom. All of our services are available to you, no matter how long ago you graduated. So it's a great opportunity for you now and even down the road. You can schedule an appointment by calling our front desk. We have the number right there. Or you can go on Handshake. Username and password is the same to use for SharkLink, SharkMail, and you can look at all of our advisors' availability right through there. We do drop-in appointments. You can see our email address also listed, but we're here for you. We want to make sure that you're going to be successful. You have all the tools, and sometimes applying to jobs or dealing with even negotiation within a job offer can be very difficult, and career development is here to promote your brand. Make sure you're applying to opportunities strategically, putting referrals on your behalf, or helping you to organize your job search as a whole. So we're here to really assist you. And we had an amazing alumni and my wife be able to join us today and share her insights. And I know how valuable it was to hear that. Rochelle, thank you so much for being our guest speaker today and sharing your insight. I know we have a participant on the line. I wanted to see if you had any questions for myself or Rochelle that we might be able to address.
I saw the last question she put says that when they ask for work experience, is it okay to add the clinical experience? Absolutely, that's okay. I would skip out on the your clinicals throughout the whole nursing program because they know that you're going through the whole nursing program. But I would definitely hone in on that clinical experience that you are applying for the department you're applying for. Like I said, I wanted to apply for pediatrics, so I made sure I put my pediatric experience in there, especially because I had that preceptorship experience with pediatrics.
You could also call that section clinical experience highlights, or you could have one, let's say you're applying like Rochelle did to pediatric nursing. You might have one section called pediatric clinical experiences, and then another section called additional clinical highlights. And it just doesn't have to mention everything, just mentions what you feel are the most valuable for them to know about. Any other questions that we might be able to address, or feedback for us or anything like that? All right, well, thank you for joining us on the call today. Again, today's recording is going to be added to our YouTube page and shared. But again, we're all here to assist you. And a big thank you again to Rochelle for taking time out of her day and sharing her industry insights and her experiences with us.
Thanks for having me. Well,
let me just take out the recording.